The nursing process is a systematic, problem-solving approach used by nurses to provide individualized care to patients. It is a framework that guides the delivery of nursing care in a logical and organized manner. The nursing process consists of 5 interconnected stages: assessment, diagnosis, planning, implementation, and evaluation. 1. Assessment. This is the first stage of the nursing process, where the nurse collects subjective and objective data about the patient's health status, including their physical, psychological, social, and spiritual aspects. It involves gathering information through interviews, observations, physical examinations, and reviewing medical records. 2. Diagnosis. In this stage, the nurse analyzes the data collected during the assessment phase to identify the patient's actual or potential health problems. Nursing diagnoses are formulated based on recognized patterns and evidence, and they provide the foundation for developing a plan of care. 3. Planning. Once nursing diagnoses are established, the nurse collaborates with the patient and the healthcare team to develop a comprehensive care plan. This stage involves setting goals, establishing measurable outcomes, and determining appropriate interventions to address the identified health problems. The plan is individualized to meet the specific needs and preferences of the patient. 4. Implementation. The implementation stage involves carrying out the planned interventions as outlined in the care plan. The nurse delivers the necessary treatments, administers medications, provides education and support, and coordinates care with other healthcare professionals. This stage requires effective communication, critical thinking, and technical skills to deliver safe and competent care. 5. Evaluation. The final stage of the nursing process is evaluation, where the nurse assesses the patient's response to the interventions implemented. The nurse compares the patient's actual outcomes with the expected outcomes defined in the care plan. If the outcomes are achieved, the plan may be modified accordingly. If the outcomes are not achieved, the nurse revises the care plan and implements alternative interventions. Example of the nursing process. Let's consider a hypothetical scenario involving a patient with diabetes. 1. Assessment. The nurse collects data about the patient's blood glucose levels, dietary habits, exercise routine, and medication regimen. They also assess the patient's knowledge and understanding of diabetes self-management. 2. Diagnosis. Based on the assessment findings, the nurse identifies nursing diagnoses such as ineffective management of blood glucose levels or impaired knowledge related to diabetes self-care. 3. Planning. The nurse collaborates with the patient to set goals, such as maintaining blood glucose within a target range and improving knowledge of diabetes management. They develop a care plan that includes interventions like providing education on diet, exercise, and medication adherence. 4. Implementation. The nurse delivers the planned interventions by teaching the patient about healthy meal planning, demonstrating glucose monitoring techniques, and discussing the importance of physical activity. They also address any questions or concerns the patient may have. 5. Evaluation. The nurse assesses the patient's progress by monitoring their blood glucose levels, evaluating their dietary choices, and assessing their understanding of diabetes management. If the patient's blood glucose levels stabilize and their knowledge improves, the care plan may be continued or modified as needed. Throughout this process, the nurse continuously reassesses the patient, communicates with the healthcare team, and modifies the care plan based on the patient's changing needs or responses. The nursing process is iterative and dynamic, allowing for ongoing adjustments to ensure optimal patient outcomes.